Risk Manager for OmniSure Consulting Group, here to give you some tips on how to keep your patients and employees safe. Serving patients in the community is the essence of home health care. Yet the community setting makes home health care providers more vulnerable to violent assaults. Home health care workers face an unprotected and unpredictable environment each time they enter the patient's community and home. The spectrum of workplace violence ranges from verbal abuse and threats of assault by human or animal to homicide. Threats are an expression of intent to cause harm. This could be verbal, body language, or written. Physical assaults includes slapping, beating, rape, homicide, and the use of weapons such as firearms, bombs, and knives. Mugging is an aggressive assault, usually by surprise and with intent to rob. Employees need to report each incident, even if they think it won't happen again or it might not be serious. Conduct training on the workplace violence plan when the employee is hired and annually. Employees need training to identify different types of illegal drugs and drug paraphernalia. Employees should be able to recognize signs and body language associated with violent assaults and how to manage or prevent violent behavior, such as verbal de-escalation techniques, management of angry patients, and recognizing and protecting themselves from gangs and gang behavior. Report all concerns of any dangerous work environments and/or threats of violence. Keep close track of each staff member's schedules. In the case of an unacceptable home environment, advise the patient on working with social service agencies, the local police department, or family members and neighbors to make the home less hazardous so care can continue. Let's discuss some violence prevention and control recommendations for the home health care worker. If possible, visit high crime areas during daylight hours. Have 911 preset in your phone or have it dialed ready to press call if you are entering a high crime area. Always know where you are going. Have accurate directions to the house or apartment. When driving alone, have the car windows rolled up and doors locked. Park the car in well-lighted areas and keep all healthcare equipment, supplies, and personal belongings locked out of sight in the trunk of the vehicle. Before getting out of the vehicle, check the surrounding location and activity. If you feel uneasy, do not get out of the car. Avoid behaviors that may be interpreted as aggressive, for example, moving rapidly or getting too close, touching unnecessarily, or speaking loudly. If possible, keep an open pathway for exiting and trust your own judgment. Avoid situations that just don't feel right. If you can't gain control of the situation, take these steps. Shorten the visit and remove yourself from the situation. Leave immediately if you feel threatened. Use your cell phone to call your employer or 911 for help, depending on the severity of the situation. Next are some situations of when to notify your employer and the local police. Report any incident of violence to your employer, or if you observe an unsecured weapon in the patient's home. If you notice strong chemical odors or suspect that there's a drug lab in the area, notify the local police as well as your employer. If someone approaches you looking for ephedrine or pseudoephedrine or needles, notify the local police and your employer. Before we go, I'd like to walk through this scenario and have your group discuss the best answer. You have a planned bi-monthly visit to the home of an elderly patient. You have been there many times and are familiar with the home and area. After you park in the driveway and start up the front walk, you notice a large dog staked in the front yard. This dog has not been there before, but is not barking at this time. When you knock on the front door, someone answers that you have not previously met. You enter the house and find your patient sitting in the living room where he normally sits. You begin the assessment when you notice a handgun laying on a table by the front door. You ask your patient about the gun, and he states it's his grandson's. You then notice a chemical smell coming from the kitchen, and it doesn't smell like lunch. What should you do in this situation? Shorten the visit and leave. Call your supervisor. Call 911. All of the above? Confront the grandson in the kitchen. The answer is all of the above.